As we continue on with the type of injury patterns, we look at these organ collisions. As we mentioned, that we have three impacts. We have the first impact being the vehicle itself rapidly decelerating or being stopped by whatever fixed force it impacted upon. The second impact would be the occupants and operator of the vehicle, and the third impact, we're looking at the organs inside the occupant and the operator of the vehicles. Now, these deceleration type impacts cause a kind of whiplashing approach. We look at another type of injury called a coup or contra coup, whereas parts of the body moves forward, the organ itself is traveling in the opposite direction that the body is moving. This is seen mostly in the cranial vault as the cerebrum gets sloshed back and forth as the head moves back and forth and as the energy is transferred. Thoracic injuries, we can look at a paper bag effect causing the lungs to collapse. We look at abdominal injuries where we have this shearing and tearing of thoracic organs or blood vessels, as well as the abdominal arteries and mesentery. We look at injuries to the solid organs as far as the liver and spleen. When we look at compression injuries, these can be as a result of falls, as we fall on the head or thoracic spine or lower extremities, or when they're wearing seat belts across the abdomen. So think about these type of compression type injuries. And we look at that, we look at the face with craniofacial fractures or musculoskeletal fractures. And as far as the thorax, we look at thoracic injuries, we look at fractures, pneumothorax, hemopneumothorax, cardiac tamponade, pulmonary contusions, and pneumothorax again. In the abdominal area, again, we look at solid organs, and they cause heavy bleeding because they supply this organ with lots of blood flow. As far as our hollow organs, we know they contain parts of digestion or products, waste products that can cause sepsis, as well as ruptured diaphragm that can cause the abdominal contents to dispel itself into the thoracic cage, decreasing the amount of expansion that the lungs can occur. Now, as we continue on with other types of sorts of trauma, we look at other types of motor vehicle collisions, such as motorcycles and ATVs. When we look at these, usually the occupants try to lay the vehicle down or the motorcycle down if they are anticipating some type of event or accident. In other cases, it's just too quick to respond to, and they have usually a head over type of incident where they travel over the vehicle, over the handlebars, and the handlebars then catch the lower extremities and pelvic area. They become a projectile and they're thrown. So we can look at lower extremity fractures, the occupant being thrown or the operator being thrown, and look for impact injury patterns from there. Angulations of the arms and extremities from normal or midline asymmetrical presentations, shortening. We also look at the abrasion patterns, and usually we would hope that they were wearing some type of safety equipment. I mean, large, thick layered pants, and a leather jacket, and hopefully a helmet. The next type of injury that we look at is pedestrian versus auto. Usually our adult patients turn away as they see the vehicle coming, so their injuries are slightly a little different. Lower extremities first, and then they kind of roll up onto the vehicle, end up into the windshield, and then being thrown down. This is that turn away versus face forward. The ones that face forward the incident usually are pediatric patients, as they get kind of stuck in deer in headlights. But because of their body size, they're much smaller compared to the front end of the vehicle, and they usually end up getting struck more in the mid-abdomen pelvic regions. Lower extremities are involved. They can end up on top of the dashboard, less rolling up into the windshield and then being thrown down. And so we're looking at multiple impacts and looking for these type of injuries. Now, other types of injuries that we look at require us to look at falls, sporting incidents, and then lastly we look at some type of blast injuries. When we look at sporting events, a lot of these sporting events, when we look at it, three big ones come to play. sudden cardiac death, and that's not necessarily injury, but it's something that we should be aware of. This is where the heart tends to have a protein that's misaligned and they go into cardiac arrhythmia, or that they have overconditioning in the aortic opening as it goes out through the left ventricle, is compromised and blood flow is decreased. The next type of injuries that we can see as a result of sporting injuries is heat illness or heat injuries, heat stroke. We're looking for them to have altered mental status with any one of the red color skin, tachycardia, tachypnea, and hyperpyrexia. Make sure that you're not just keying in on that they have stopped sweating, although that was one of the key indicators in the past. Look for altered mental status, shifting us between the heat casualty being a heat exhaustion and heat stroke. And the last one will be musculoskeletal. So we'll see a lot of different type of musculoskeletal injuries. We need to listen to the history and then decide what type of injuries profile that we would see. Head-on tackles, we look at the neck and head. If we're looking at them being tackled from the side, we may be looking at lateral impacts and towards the knee, the hip. Depends on whether or not they plant and how they fall. They could fall in an outstretched arm, causing fracture to the upper extremities. Vertical falls, these are falls from heights. We need to be aware of the height, what surface that they landed on, if they struck any objects, and what body part was involved. A lot of times these injuries happen at home, and the injuries are received by our elderly population. This is where one of our injury prevention programs is to curb the falls at home. 15 feet is about 1 story. And we're looking at least 20 feet being pretty lethal. In the past, we had used something that's 3 times the patient's actual height. We know that elderly people can fall from a standing position or maybe even less, and that can cause severe brain injury. Remember that our elderly or geriatric population, we do have some cerebral atrophy at that time. We may be plus or minus on any type of comorbidity, taking blood thinners, diabetes, previous strokes before. And it does make it hard if they have some mental incapacitation or altered mental status as a normal baseline. A lot of times, adults, when they fall from a vertical height, will fall and land somewhere on their feet, calling an axial loading, and that would be more of a compression type fractures up along the spinal cord. Whereas pediatrics, they tend not to land on their feet, they tend to land more on their head or their side. Again, if we're landing on our feet for an adult patient, we'll look at calcaneus fractures, lower extremity fractures of the ankle and malleolus, up to the tib and fib, maybe the knees, and then this energy transferring as it goes indirectly up through the long bone of the femur. We may see it fracture in the pelvic girdle. We may have injuries of the thorax and thoracic and lumbar spine. All right, one of our last ones here, we're talking about blast injuries. When we think about blast injuries, we have 3 different types of blast injuries that we need to be aware of. The primary blast is just this pressure wave. As this explosive goes off, it causes this pressure wave to come out. This pressure wave travels at a great rate of speed, causing hollow organs to be damaged. We also look at potential these blast waves causing barotrauma to lungs as well as the eardrums. The secondary blast injuries, we look at waves of debris being thrown from the blast site or an explosion site. So this wave of debris causes lax because of fragmentation and penetrating trauma as it throws things into the air and it strikes our patients. The last is the patients being thrown from that concussive blast wave as well as the debris wave, and they land after being thrown. So we need to be aware of what they've landed on, how far they were thrown, and the position that they landed in. Miscellaneous things in our blast. There may be fires and collapse and secondary blasts. We'll look at additive issues, chemical, biological, radiological mixtures that may have been added to, or maybe just a coincidental part of the structure that was damaged. So again, we need to manage the injuries from the blast, fragmentation, and the patient being thrown. Some of these are primary, confusion, dizziness, headaches, And severe ones, abdominal hemorrhage, pulmonary embolism, perforated eardrums, bowel perforation, chest wall injuries, abrasions, secondary fractures, lacerations to the eyes, perforated bowel from flying material, and then being struck to the ground and causing fractures and spinal cord injuries and such. We look again at the quaternary, having some toxic inhalations, fumes, and any other byproducts. What we like to stay away from is that there is also a possibility of these blasts being a cause of terrorism. And so think about these areas as a safety consideration, but we need to take care of our patients.